Hello, everybody. Oh boy. Good afternoon. We'll go through some of the data and then take some questions. Unfortunately, we lost another member of the community over the last 24 hours. She was in her 20s. She had severe underlying conditions, but died of COVID-19. So certainly we think about her and her family and everybody we've lost in this process. Testing-wise, decent testing day. We had over 5,500 tests. 7-day rolling average is at 3.9%. Our 14-day rolling average, 3.6%. And our daily positive rate of the last 24 hours, not what's coming, 3.9%. So over the course of the community, things have seemed to stabilize a little bit. So that's, I guess, one way to look at it being positive. Hospitalizations continue to be an issue that we're watching. The good news is our hospital stays are shorter. The bad news, more and more people need the hospital. We now have 84 individuals in the hospital. That's 10 new admissions. That is 6 discharges. And so to give everybody perspective, we've always said you can chart this out. It's been through the whole pandemic. Really between 5 and 8% of our active cases turn out to be hospitalizations. So when you have more cases, your hospital numbers are going to go up. Over the last week, we've had a 47% increase in hospitalizations. We haven't seen it as much in our actual number of hospitalization numbers because we have 84 people in the hospital, and that hasn't, when you look at that, we haven't gotten shock like we would have in the beginning of the pandemic. In the beginning of the pandemic, it was, 20 days would be your average hospital stay. Now it's 4 days. The ICU stay was even longer. Now it's 6 days. But more people are getting sick enough to have to go to the hospital. So for our friends who have downplayed this as being a situation where only certain demographics get sick, meaning our seniors and those who have pre-existing conditions, that's true. Our seniors and pre-existing conditions do get sick, but others get sick too, and sick enough to have to go to the hospital, and that's happening quite a bit now. I want to thank our hospitals and thank all of our frontline workers for the great work they're doing for all of our neighbors in the community. Because of their great work, our infrastructure is not being strained to the point where we have to look at readjusting elective procedures and things of this nature. That's not where we are because of their great work. But the community needs to respond, and I think we're responding. I think we're doing a little bit better now than what we were doing 2 and 3 weeks ago. So hopefully we'll see that play out, and hopefully if cases start to stabilize, we'll see that hospital number start to decline. When we look at the other fact, though, here is that in our calls with our hospitals, we have been talking to them. They are expanding their ICUs at this point in anticipation of further surge. So it is something that we're planning for right now and that our hospitals are working on right now. When we look at cases, we have 8,195 positive cases. That's 227 new cases. That is essentially down 13 from yesterday. Another trend is our Wednesday, Thursday numbers. Usually, there is an outlier every once in a while, but usually Wednesday, Thursday are our busiest days. And so that is holding true here. 42 of these 227 are related to higher ed, and I believe another 30 are related to K through 12. So the positive news there, these higher ed cases, are leaving the community soon. So that will slow down. I think you heard the governor asked a question today at his briefing related to when you look at zones and why aren't you in an orange zone or a red zone or a yellow zone. It's not just a up or down issue with the zones. They look at all of the factors, and we have calls with state DOH, and we look at all the information on the ground. And certainly with the increase in cases with higher ed and then Syracuse University going remote, that impacts our numbers, that impacts our data. So these don't get held against us because there's a narrative there. And then when you separate that narrative, where are you, the data merited yellow zones, how are you doing in those yellow zones? The 7-day average shows that the yellow zones, the positive rates are going down. And yesterday, actually, they went down quite a bit. And we think they'll continue to go down because of increased testing that we've done and also mitigation the community is doing, and also some of the mitigation on some of the businesses that have led to cases. When we go back and look at how many people have, out of today's numbers, besides college and K through 12, we did have 15 senior cases, 8 of those being, I believe, staff, 7 of those being residents. So we'll watch the residents very closely. That's concerning. 11 travel cases, so that's a big travel number. Travel from all over the place, so it's not it's out-of-state travel, some in-state travel, 2 Florida, 2 Virginia, 3 Pennsylvania, 4 in-state. So these are all things that, again, the travel we get for work, that's something that some folks that are essential have to do, but certainly if you're traveling, that's your decision. And you know that there's high transmission going on in our community. It's even higher in other communities. So that's risk that you're taking, and that those are your calls. Looking at community spread, we have 169 community spread, 34 still being investigated. So we're catching up on cases each day, and have a better idea where they're coming from. Getting a little bit better there. Overall, 4,413 cases have been female, 3,779 have been male, 1,150 under 19, 2,012 in their 20s, 1,127 in their 30s, 971 in their 40s, 1,137 cases in their 50s, 790 in their 60s, 465 in their 70s, 351 in their 80s, and 192 in their 90s. Related to testing, again, a lot being reported on testing. Let's go over the testing that we are helping to manage. There's lots of testing in the community. We understand the need when people feel that they're exposed or symptomatic. They want to get a test and want to get it right then and now, and they want to get their answer right then and now. The reality is that we have never had symptomatic rapid testing in our community. We've been trying to buy it for months, the type of rapid testing that we believe is most effective for somebody who has symptoms. We know that there were some private market providers in other communities, and they're backed up. So that what we consider to be rapid in COVID-19 terms is a 24 to 36 hour turn time for symptoms. We have provided asymptomatic rapid testing. You've seen it all. Everybody who's here today has seen it all. They walk by it right here. The demand is very good, and we've increased capacity for that. But let's go over our symptomatic exposure testing. Again, if you're exposed on day one, you might be exposed to COVID. We don't recommend you get a test on day one. We recommend you actually wait 4 or 5 days if you're exposed to see what happens with your symptoms. But if you were going to, for our K through 12, again, we have saliva testing at the FSHED, partnership with Upstate. Certainly, we think you can call for that, 315-464-2582, or you can create a MyChart account at Upstate to pre-register, mychart.upstate.edu. That's K through 12 saliva testing. And again, that capacity is going to increase in the weeks to come because Upstate will no longer be doing the testing for SUNY. So they'll be able to do more K through 12 testing at Upstate. So more slots will be available because their commitment to the whole SUNY system, that's hundreds of thousands of tests a week they've been doing. They're part of the SUNY system, so they have to do that. Capacity will be increasing there moving forward in the months for our schools as schools come back from Thanksgiving, but the colleges are not back. For our other partnership for all other symptomatic and exposure cases, you can go to ongov.net/Cayuga Medical and register for an appointment. That way, we are increasing capacity there as well each day. So we'll have, essentially about 300 tests a day for symptomatic folks through that line. There's about 180 a day through the saliva sample for K through 12. That capacity will be increasing again. That doesn't mean you can't go to other Upstate sites. It doesn't mean you can't go to St. Joe's. Doesn't mean you can't go to Krause or your doctor or Syracuse Community Health Center. Those are other sites in the community that are doing testing as well. There is no more asymptomatic testing at the FSHAD. We've moved that all over here to the ON Center. For asymptomatic testing, we have an asymptomatic rapid nasal test here at the ON Center. Our hours are 9 to 4. Starting Saturday, we'll be doing it. And then we will be 9 to 4 Monday through Friday. Starting Saturday, we will be doing weekend testing here at the ON Center, 10 to 2 for both days. We need you to pre-register, and this is for folks who are not symptomatic. You go online, covid19.ongov.net, and you can come here and get a asymptomatic rapid test free. Our yellow zone testing. This is day 4 of yellow zone testing. To date, we have tested 3,322 school children and staff at 45 different schools in order to keep these schools open for in-person learning. We have had 6 positives out of the 3,322. And out of these 6 positives, we have a positivity rate of 0.18%, which is a great rate. It shows you that in schools, transmission is not occurring. These are asymptomatic folks, so we found and we hunted and found these cases that were there. But overall, schools are a very safe place for our students and our faculty. Many of the cases that we report every day that are K through 12 are now related to household contacts if they're kids. They're getting it from mom and dad because we've had high case numbers in the community. Or folks are getting it in the community and then getting sick. They just work at a K through 12 school. So that is our program there. By close of school next Tuesday, we will have completed testing at every school in the yellow zone. We have 36 more schools to do so that they can continue to operate after the Thanksgiving holiday. So again, I want to thank our workforce who has taken on this really unprecedented challenge. They will have tested over 7,500 school children in under 8 days. And also want to thank the Syracuse firefighters and the mayor for helping, letting us have these folks help with our testing in the yellow zone in the city school district. That's been very, very helpful for us. But to give you an idea, today we had over 1,282 tests. I believe we've had 1 positive today, and it was an adult. But we tested at Roxborough Middle School, Solvay High School, Parkview Academy, Syracuse Academy of Science Middle School, SAS Citizenship Academy, St. Rose of Lima, Jawonio, Bellevue Elementary, Delaware Academy, Ed Smith, Lemoyne, McKinley Brighton, Roberts, Dr. King, and Webster, all tested today. So a great effort by the community to get this done to keep our kids in person learning. Again, reminders, let's stop the symptomatic spread. Asymptomatic spread's tough to stop. Nobody knows you're sick when you're out and about. That's why we wear masks, we distance, we avoid gatherings. But for symptomatic spread, this is something that we can stop. We got to rule out COVID when we have any symptoms. If we do this, we'll stabilize data, we'll flatten all our curves, and we'll go in the right direction. And this is really critical that we do this to keep our economy open. Saying all that, that's the data. Happy to take questions. Yeah, that's new. So 10 to 2. You got to pre-register. I know there are still some slots available, but again, this is kind of it's remember, asymptomatic testing. Why are we doing this? We're doing this A, because we have the tests. B, because we know we've had success finding hidden pockets of the virus. And C, we know people have anxiety. So it's a nice bonus and benefit to give to the community when we can do all this. Up to 500. Mm-hmm. Yep. It will go down. We still have community spread. So we got to flatten it first. So we got to stop the bleeding and the hemorrhaging, and I think we're getting there. And then through the mitigation efforts and the modification of behavior from everybody in the community, we'll start to see the numbers go down. So week over week, 2 weeks ago to last week was 90% increase in cases. So far, week over week, we got a small increase in cases, but almost on par with last week. So this could be the week where we start to stabilize. The caseloads are still too high. But then we start to starve this thing. We know when we change our behavior, it's going to take us 2 to 3 weeks to really see a change in the data. So hopefully we're doing that. We have a challenge in front of us. We have Thanksgiving holiday. That's a challenge. Many are forecasting bad outcomes from Thanksgiving. I think we're smart, and I think we know that large gatherings present risks. And so we're going to mitigate those risks in a community, and I think we'll respond. We know. Everybody knows what Halloween did. And anybody who says Halloween didn't do anything, you're wrong. You're flat out wrong. We contact trace. We know for a fact that small gatherings led to cases. We know for a fact that large gatherings led to cases. So don't argue with us that Halloween didn't do anything. It did. It pushed us into this second wave. So we know that. We're going to learn from that, and we're going to have a successful Thanksgiving, I think.
Right.
Mm-hmm. So what this will do for parents is this will allow us for the K through 12 symptomatic cases, right? So right now you got to rule out COVID. If you're sick, that's what we want the community to do. K through 12, to get your kid back into school, you got to rule out COVID, or you got to get a doctor's note. The doctors want you to rule out COVID. So right now, what's happening is the saliva test is so popular, we have more than 180 people that would get that test. And so right now, those people then go to the FSHED Cayuga line, which takes up some capacity for other symptomatic people. And then those people then go to the Syracuse Community Health Center. And sometimes there's lines. So what this will do, we'll get more tests, and all the K through 12 will hopefully be able to go and use the saliva test. And then our Cayuga line deals with all the other symptomatic cases, and so does Syracuse Community Health Center. So folks who want to get a test are getting it right when they want to get a test. They don't get the results back right when they want to. A lot of people want to go get that result in 15 minutes. I want to be able to deliver that. I've been trying to get these tests for 3 months. It's not that easy. The supply chain isn't there.
Ryan, 84 hospitalizations today, and that's by far more than you've seen since, well, at least the beginning of June, by 10, 15% more even. And you talked about a surge. That's a word we haven't heard in a while. Can you describe the conversations you're having with the hospitals now about preparing for more patients in the hospital because of the larger counts of positive tests, and And what's their expectation for how much higher that number is going to go?
Yeah, so great questions. The fact that we are preparing new ICU beds shows that that's something that we're seeing the increase, and we think that there will be more cases. With more cases, what we can't bank on is these great turn times we're having with people recovering. People recover when they recover. Because the therapeutics have been working better on these patients that come in yesterday and the day before, doesn't mean they will work as well on the patients 2 weeks and 3 weeks and 4 weeks from now. And if you saw a situation where the turn times get worse from people getting entering the hospital sick to getting better, then that will create more backup and the infrastructure will get strained. So we got to make sure the ICU beds are there. That's what they're beefing up for now. Even though we only have 10 in the ICU today, there's still capacity there, but we got to be prepared. And again, in the event that the overall medical system starts to become strained, that's when we'll lose some of these elective surgeries again. And that's when that would be phase one of that mitigation, is those start to slow down and only certain elective procedures get done, and then potentially those are in risk again. And then after that is when you look at some of the plans that we did early on in the pandemic but never had to implement. You look at other planning and preparation moves. We talked about Manley Fieldhouse being a spot where we would have a makeshift hospital if needed. Those plans are there. The infrastructure is there to implement. We're not there, but Matt, we're thinking about these things and we're preparing for them in the event that the worst case scenario happens.
But hospitals are moving to increase their ICU capacity right now?
Correct.
Because of the increasing number?
Yeah, just because the trends, you have to prepare for that, right? In the event that you got 84 people in the hospital, some of them get sicker, you got to be ready. And we know there will be more hospitalizations tomorrow. We know there'll be some recoveries, but right now the 4-day and 6-day turn times, how sustainable are those? We don't know that, right? So we prepare for the worst.
And on a grim note, following that up, first of all, condolences to the family of the 20-something-year-old person who passed away. Is your expectation in your conversation with the hospitals that there will also be more deaths on a more regular basis in this next stretch of time, a couple of weeks anyway?
So Dave, the mortality rates have gotten a lot better, but I've lived through the first wave of this. We all have. And when your nursing homes get cases and your senior centers get cases, we don't always get good outcomes there. So that's why we track this very closely and why we put in wastewater testing in some nursing homes. The challenge is once you get, it's an early indicator, then you can come in and test. But once you have 1 or 2 cases in those facilities, the wastewater early indicator goes away because it's in the building, then you'll pick it up. But we're concerned about when we see cases with our seniors, because that's where we've seen the heavy numbers of mortality coming from our seniors, and then folks who obviously have the underlying conditions and have a hard time dealing with this virus.
You know, Brian, how many new ICU beds we're going to create?
Yeah, I think what they do, Tim, is they take other beds they have and they transition them into ICU. I'm not sure exactly how many they're doing, but it's something they're preparing for, as they should. You have enough COVID patients in there. ICU beds are used for everybody else in the community as well, not just COVID patients. So you know you're going to have victims of violent crime. You know you're going to have car accidents. You know you're going to have heart attacks. So you need these beds ready, knowing that you got 84 COVID patients. And when the COVID patients come in, for the most part, they come in because they're having a hard time breathing. So those, you don't gamble with that. Those can turn really quickly into ICU situations.
Is there a hospitalization increase that you're expecting just based on the current positivity rate?
Yeah, so we always look 5 to 8% of our current number is, how many active cases do we got? 1779. I don't have a calculator in front of me, but that's what we look at. Now, what can change now is that the because the recoveries are happening faster, your 84 number moves up in small increments. It's moved up in small increments each day. It hasn't moved up in large increments. Some other counties, I saw county to the west, I think they had 19 new hospitalizations, net 19 new in one day. That's a lot. We haven't seen that kind of, but we're seeing the small increments. So those are the early warning signs that you got to prepare for everything, which everybody
I've got
is.
a calculator. What's the percentage?
Usually 5 to 8% of the active cases have played out to yep, 1779. I'd do 8% on that number, see where we are.
So it could go up to 141 hospitalizations based on the number of cases, which is
Could. And if it wasn't, and again, that if we weren't,
that's 70% more than now.
yep, that's what,
How much more ICU capacity would be needed for that?
I'm not sure the exact number, Matt. We'd have to talk with the hospitals themselves and see where they are. But that's, what we've seen in this pandemic. That's. There's part of this virus is it does better under these conditions when people have to go indoors again, and so there's a level of this where it's nobody's fault, and it is what it is, and we prepare for it, and we're ready for it, and we plan for it. Where we can have an impact is the things that everybody knows. They can say them in their sleep, but you modify your social gatherings and who even look, and again, people don't like to be told what to do, and people say the county executive's not going to tell me what to do, or the president or the governor or whatever. I get it, but we can modify our behavior, and that can have a positive impact. And the other thing we can do is when we get sick, we can rule out COVID and right away and just pause life until that's done. And that's a real public service if people do that, because that will help us dramatically. And so that's what we can do. And even if we do all those things, we'll still have cases, and we're still going to have cases. What's different now than March is there's 2 high-performing vaccines that we believe will have FDA approval in the near future, and that our community is vulnerable at some point. We'll have a vaccine sooner than later when you look at the fact that we're almost in December, right? So that's what's different, and so light at the end of the tunnel. Let's just get there. I think our community is going to respond to the Thanksgiving challenge that we're hearing from all the pundits and the health community. I think we're going to respond, and I hope we're right. I think we know better. These large gatherings truly represent risk now, more than they ever have in this pandemic, and we need to avoid them.
I have a question when it comes to contact tracing. I know that the health department, they shifted focusing rather on the public exposure points, more on contact tracing now with the rise in cases. So I'm just wondering how the health department is doing keeping up with the contact tracing.
Yeah, so there's 2 parts of it. It's case investigation, then it's making the phone calls of the contacts to do that part. So we're doing more on the investigation side, the contact tracing of the contacts of the people who had contacts. The state's doing at this point. It's getting a little bit better. It's stressed. Everything is stressed. Everybody and everything in this pandemic right now is stressed. So it's people need to help us with that and not get frustrated with that. If you are told that somebody you know has COVID and you are in contact with them over a period of time, do the right thing and quarantine and isolate and wait for the call. And at some point, it may never happen because you didn't have direct contact during that. But we just need to grind this thing out together and use common sense. We all know so much about this because we've been dealing with this for so long. So, but we can't come up here and say the system is not being stressed. The system is being stressed every part of this country right now in the world.
And with that being said, I'm sure that each situation is different because of how many people might have been in contact with someone who tested positive, but what is the time frame do you think that people can maybe expect being called from the health department when it comes to a contact
Yeah,
tracing investigation?
once we have notification of the positive case, it still should be your 24-hour period. There might be, if there's 227 cases, could there be 15 cases that aren't in a day contacted within the 24 hours, but it's 36 hours? Sure, but for the most part, it should be within the 24-hour period.
Ryan, were you tempted to drive by Shoppingtown today?
I did not drive by today, no.
Now that it's a day after the bankruptcy hearing and your announcement, what are you thinking about? Why let Moonbeam off the hook but put taxpayers on the hook for becoming an owner of a shopping mall?
I would disagree with the premise of your question. We didn't let Moonbeam off the hook at all. Moonbeam owns the property. They exercised every legal option they had because we pushed them to that point. They didn't get to bankruptcy court because our administration was playing softball. They got there because we were playing hardball. And so when you look at the facts of the bankruptcy court and what the options were for what could happen to the county, Moonbeam was challenging their assessment. And that was being challenged in a court in Onondaga County. But the bankruptcy judge, mind you, the Shoppingtown Mall is assessed at $33 million. The bankruptcy judge gave an assessment for 2020 of $4 million. So if a court sided with Moonbeam related to the assessment, and I think right now everybody knows it's not worth $33 million, what that does is the amount of money owed to Onondaga County now gets dropped. So Onondaga County's out the same amount of money, but Moonbeam now only has to pay us back so much more. So what's our option then if that happens? Our option at that point would be to go sue the people that actually owe us the money. So who owes us the money besides Moonbeam then? The town of DeWitt and the Jamesville DeWitt School District. So is that a good option for us, the county, to be in? Do we want to go sue our school district and the town for millions of dollars so then they turn around and sue and raise their taxes probably 20–30% for those communities? Not a good situation to be in. So that's where this was going. And so Moonbeam, what's their advantage? Their advantage is they know that they've probably run out of time, and why do they want to risk the assessment either? They know that it's not worth 33, but it's worth more than 4. And can they have a functioning property after that? And so the bankruptcy judge put out a mediator, and their goal is to basically, the mediator says, you come to a deal or I'm going to tell the judge you're not cooperating. And so we came to a deal. And the deal gives us the opportunity to do really the number one thing that we've wanted the whole time was we've already lost this money, right? The money's gone. So our number one goal was to get this property and have it be a performing asset, again, for the community. The only way we can do that is through site control. So goal number one in this deal is accomplished. Number two, through site control and an RFP process, of which, by the way, this has been on 24 hours, we've had multiple inquiries. By doing this and having the RFP process, and then through a sale, the taxpayers will recoup some of this money. But moving forward, the bleeding stops. Because what would happen, Matt, next year? We're almost there. It's almost next year, right? We're almost at the next cycle. We would give a check to the school district in the town, money out of our checking account, chase Moonbeam, and they wouldn't pay again. So this has been a cycle. It's been going on 5 years. So we broke the cycle. We're going to get site control. We're going to get a bunch of our money back, if not all of it. And then moving forward, we're going to get paid. So that's what this deal does.
Well, Moonbeam also is getting paid essentially the new assessed value, $3.5 million. Plus, they don't have to pay $13 million in back fines and taxes, and they stand to make millions more if you sell it for a really good price down the road. So it's not that they're not getting anything.
Yeah,
quite a bit.
Yeah, I think the point you're missing is that they weren't going to owe $13 million in taxes. That's the point. That number's $4 million of that's in penalties and interest, and the $9 million that was left there, the judge already tipped her hand. And so from going from 33 to 4, anything close to 4, they would owe us very little. And so then the people that owe us the money are our own residents. Are we going to go bankrupt a town or a school district for back taxes on a mall? No, that's not something I'm willing to do. So then what is your option then? Your only way to try to get your money back is to do exactly what we did.
What about other people that have, or other companies that have control over sections of the mall, like Benderson, for example, for Macy's and the Sears buildings?
Mm-hmm.
Is it really the county's full control if this deal goes through, or are there other players still involved?
They certainly control their own space and their own real estate that they own. And I'm sure those two entities will probably be interested in an RFP process, I'm sure.
And also, in terms of a timeline for when you could expect, in your best vision, for there to be a new repurposed space there. First of all, do you see it being torn down as the primary option?
I don't know. I think to have it all knocked down, you would probably have to have quite a project on your hands. So the beauty of this is that there's lots of plans for that property. The town of DeWitt's done planning. We've asked our planning department to look at some best practices, and part of the RFP will be this will not be a fire sale. Give us your best price. Price will be part of the RFP, but the criteria will also be what comes next and how does it meet the need of the county, how does it fit the needs of the town, how is it driving economic activity and growth moving forward. So you could have lots of different things. It's a very large campus where you keep some of the existing buildings, some of it you don't. Certainly there's owners of other parcels in that building, so you got to deal with them. But I think that part, the redevelopment will play itself out. There's a lot of interest for that.
There's also no lending taking place for retail right now, nationally.
Yeah, I wouldn't think retail would be the only component of anything there. That model didn't work with the existing mall, so I think you have to look more at a town center, a mixed-use type project, or a mixed-use type employer-driven project. So there's lots of opportunities there.
And with regard to the mediation, how involved were you on the mediation? Were you on the phone with your attorney? Who was creating this negotiated deal in that space?
Yeah.
Did the mediator create the deal and then everybody said yes? How'd that work?
Well, this has been going on for some time. I've been subpoenaed multiple times and spent hours and hours of testimony given by their lawyers, and this has been talked about very publicly. So there's a very broad record on my comments here on what our interests were. It was about getting to the point where you can get to a middle ground and certainly feel good about where it's going. And certainly there's certainly some leverage that they had, and there's a little bit of leverage that we had as well. So if your goal, and your goals matter in that. If our goal was to have this be a performing asset again in the community, something that the community can be proud of, if that's your goal, you got to take a different tact than our goal, no matter what, is at all costs just to get as much money as we can, knowing that you could get another actor come in and do the exact same thing that Moonbeam did. So, if that was the case in our mediation, we would have said, let's just go jointly sell it for the highest price together. Things like that were on the table, but we had multiple goals. We think we can accomplish all of them with what we got.
When you take your kids down Erie Boulevard in 10 years, what do you hope to see?
Yeah, it's a great question. I think we'll see a performing asset, but I think it'll be something different. And I think you'll have an economic development, jobs component to it. I think you'll have a mixed-use component to it. I think you'll have a residential component to it. A lot of other communities have done these types of projects very well. So I'm sure there will be a lot of interest in this. But this has been a pretty long process with this entity, and so the different points, the game, we thought we were in better position than they did. And at the end of it, I think we got to a spot where we are going to get what we want. And that's going to be making sure that moving forward, that entity, whoever owns it, pays their bills. invest back in the project and into the community, and because of that, we think we'll get paid back, if not all the money owed to us, pretty close to that number. Yep.
Brian, in terms of the cluster of COVID cases up at SU,
Mm-hmm.
does the university do contact tracing completely independent of the county? How does that work?
Yeah, they do. They do help us out tremendously. They have a team that does that. They work with our team. At times, they'll have challenges with their contact tracing, and then they maybe at that point turn it over to us. They're very similar to New York State on what they do for us, and they do even more of the case investigation part in the beginning, because they have some real leverage with the code of conduct that these students have signed on to, and they've been very good partners with that.
If they identify someone who has to quarantine, do they turn that over to the state? Is it the same official?
We give out all the quarantines. Yeah, so they turn it over to us, and then we give out. Yeah. Correct. Correct. Josh, did you have something? I wasn't aware of that, but I think there's a practicality to a lot of things. When you have 20 deputies in a county our size who are going from call to call anyways, there's a practicality to that. Certainly, I think if you have a large gathering, the sheriffs will respond. Everything you do in law enforcement, and I've been in this a long time, and we run a program called 911. And so usually people call 911, and so everything's driven by priority calls anyways. When I saw this policy, I knew this would be an enforcement challenge, to say the least. So it doesn't surprise me that multiple sheriffs are out taking the positions they are in, because they probably don't have the people to do the job to begin with, and then you're putting your police officers and your deputies in difficult situations. And so I think when you get these executive orders, everybody knows the intent. The intent is that right now, whether you call them living room gatherings, small gatherings, whatever they are, they're producing cases because the virus is so widespread. So if people live by the honor system and limit their gatherings and make them smaller, I think that will have an impact. Whether that's 10, 11, 12, 13, 8, 7, 6, 5, the number is the number, but I think the messaging should be people should recognize larger gatherings represent risk to their health and everybody else's.
Speaking of, on Wednesday evening, are any county officials going to enforce the bars closing at 10 p.m.?
Yep. Yeah, Wednesday. Why'd you say Wednesday? I'm curious. Did you pick that day? Is that the biggest drinking day of the year? Did you know that? I used to go out on Wednesdays before Thanksgiving when I was a lot younger. That's not going to, people got to be smart. This is a pandemic. SLA, the county enforcement units will be out. And it's, again, the data shows where the cases can spread. They can spread at the gatherings. Bars have been a problem. So certainly the hours will be enforced.
Anywhere in particular?
The units actually hit, they have a unit that hits suburban areas looking to make sure people are compliant, and then there's another unit that hits the urban areas as well. And SLA usually comes in and there's coordination. So SLA may say, we got this, you guys go enforce something else, but we have a team that works with SLA on that. But again, the idea is here, 10 o'clock's 10 o'clock, everybody knows that. But when you're open before 10 o'clock, that's not a pass not to follow the guidance. You got to follow the guidance. Other questions?